Okay, excellent. Thank you so much for joining. My name is Laura Santner. I'm actually coming to you here from New York. I'm sure we have lots of people coming from all over the world. I am a licensed clinical social worker. I'm also a registered poetry therapist, and I've actually been a therapist now for about 17 years. And I've worked in a variety of settings where I've worked in some hospitals, outpatient clinics, private practice, and now here with TrickStop and with SkinPick. I've been professionally trained to work specifically with BFRBs, and I also have personal experience with BFRBs. So I come to you with a very unique perspective. So this will be a very casual question answer session. I'll do the best that I can. I see some questions coming in already. Some people pre-submitted some questions, so I will maybe start with that. And feel free just to ask away, and I will check periodically this question and answer session button. Also, if I cut out at any point, my internet's been like a little wonky today. Just bear with me and it will come back up in a second. So a question that was submitted before this session is the cause of trichotillomania due to stress factors only, or is it also common in other disorders like autism and ADHD? So trick is actually not necessarily related to stress. Urges can occur basically when someone is overstimulated or understimulated. So stress is an example of when someone is overstimulated. An example of being understimulated is being bored. So someone who has, the other part to this question is someone who has ADHD and autism, they can also have trick, but they don't necessarily have to. So BFRBs, trick, can stand on its own. It does not mean that you also have autism or ADHD. Factors like autism and ADHD, they do impact urges and how you react and how you manage them. So there's definitely a relationship there, but one does not have to, just because you have one does not mean you're going to have another. Okay. I hope that answers that question. Another question that came in before the session. Again, I'm just going to get to those pre-questions first. I see questions coming in and I will get to those next. So thank you. Keep the questions coming. Would you advise trying NAC supplement with doctor's approval first? I've read users in research trials have seen decrease in symptoms. So actually, NAC, which stands for N-acetylcysteine, is actually the most researched medication for BFRBs so far and the most promising. So it's an amino acid supplement. And the most common side effect is an upset stomach. So I do recommend trying it if it's something that you're considering and if it's okay with your doctor. You just never know. So might as well try it, right? And see what works. Everything works differently for each individual. So talk to your doctor and give it a try. I have some links to articles, but I don't actually know how to post them. Let me actually go to the question. Let me see if I can. So there are articles out there. If I go into, let me see, can I post them? Answer, no. Okay. Okay, well, I have articles. So if you can't find articles on the topic, let us know. Just send us an email, like at support@trickstop.com, and we can get you the links to those articles. There is an article on trickstop.com, trickstop.com/treatment/medication N-acetylcysteine, ACETYLCYSTEINE, and you will find that article. Let me see. Someone asked, what is the link between autism and BFRBs? I'm finding that a lot of people are asking this question. I'm seeing it pop up more and more. So actually, as far as I know, there is no link. Again, someone can have a BFRB but not have autism, and someone can have autism and not have a BFRB. It can affect the urges, though, and how you manage those urges. Let's see. Oh, okay. Got some good questions coming in. Okay. When I pull my hair, it comes out easily. Is that normal? Or is this because of a history of pulling? So actually, yes, it is normal. I mean, hair comes out, we lose a lot of hair daily. So long history of pulling does not necessarily affect the strength of your hair. A lot of different factors can affect the strength of your hair. Hair does grow back at different rates, and it goes through different stages of growth. So, if you are finding that it's coming out more easily, only you can be the judge of if it's coming out more easily than usual. But if you're really concerned, I do recommend consulting with a dermatologist, because they can do some additional tests just to see if anything else is going on. And by the way, if you're not satisfied with any of my answers, again, please feel free to ask follow-up questions in the question and answer section section. Does all hair grow back, or is hair growth changed after years of pulling? So does all hair grow back, or is hair growth changed after years of pulling? Yes, hair grows back, and it's surprisingly resilient. It does grow back at different rates. So some areas, depending on where on the body, will grow back faster than others. You might also find that it grows back with a different kind of texture or a different color. And that can be kind of frustrating, and can increase urges if you see like, a gray and it wasn't gray before, or if it's like a little bit kinky and it wasn't like that before, can increase urges. So it can be a little bit difficult and frustrating, but yes, it grows back. And over time, it kind of goes back to its usual state. The only time it may not grow back, a sign that it might not grow back, is if that area gets to be very shiny. And I don't mean just like a little shine like it's oily. I mean like you'll know the difference. It's like quite shiny. But that might not ever happen, and it's also pretty rare. It can happen, but for the most part, hair does grow back. Okay. Why is the emotion of frustration such a big trigger for pulling? Oh, I like that question. Why is the emotion of frustration such a big trigger for pulling? I mean, it's a big emotion, right? We don't know what to do with that emotion, so it kind of bottles up inside. And then what do? Is we kind of take it out on ourselves, if that makes sense. We have no place for that emotion to go unless you have other and helpful coping strategies. But I find that emotion of frustration, we want to take it out, and we don't know how to take it out. We don't know how to express it, so wind up pulling. So I hope that answered that question. Again, if I didn't, ask a follow-up question. Which is more common trigger for pulling, boredom or frustration? Both. So as I mentioned before, common triggers are feelings, situations when someone is overstimulated and understimulated. So boredom is a common situation when you're understimulated, and frustration is a common feeling for when you're overstimulated. So both, I would say, are equal. One is not more common than the other. They both are extremely common. How do you react when people say that trick is self-harm? Yes, I was expecting this question, actually. You know, more and more people are thinking that trick is self-harm. However, it's not. So self-harm is actually done with the goal of having the intention to hurt yourself. And the intention is there to reduce a sensation or of discomfort or emotional pain. And a BFRB, people who are pulling are not intentionally trying to hurt themselves. They're doing it instead to kind of self-regulate themselves, right? When you're feeling out of balance, again, overstimulated or understimulated. So it's not with the intention of harming yourself. It's with the intention of trying to self-regulate yourself. The consequence of pulling, that outcome, those spots that occur, I don't like using the word damage, so I'm saying spots instead. So when that's created, that's an unintentional consequence. You know, we're not going into pulling with the intention of causing bald spots. So it is very different from self-harm, but commonly mistaken as such. Can you treat adults with autism, with intellectual disability, with severe expressive language disorder? I'm not sure I understand this question, actually. Can you treat adults with autism, with intellectually disability, with severe expressive language disorder? If this is a question related, maybe you can resubmit it and clarify. But if this question is related to, oh, I see a hand raised. Oh, how do I do that? Hold on a second. Yeah. Let me see if I can. A hand raised. Okay, yes. I'm going to allow you to talk so you can clarify your question. Hold on one second. Okay. Did I do it? Marsha, are you there? Can you clarify your question?
Hello?
Yes, hi.
Oh, hi, thank you. I'm sorry, the question's not clear.
No,
So,
no worries.
so my son is an adult with autism with intellectual disability, and he lives in a group home.
Mm-hmm.
He has a habit of biting and picking the skin on his lip. He
Mm-hmm.
used to only do it during the winter season when the air was dry and everyone's lips get chapped, but he was just OCD about it. He just couldn't stop, and his lips would get all raw and kind of almost bleeding, and they looked horrible and chapped and very unsightly. But he would stop when the spring and summer would come. And I
Mm-hmm.
noticed that just beginning last year, he didn't stop when the spring and summer came. He kept on biting and picking his lip throughout the year, and he's continuing to do it this year. So
Mm-hmm.
I see it as a progressing problem. And I actually worry about his lip getting so raw and infected. Uh,
Mm-hmm.
that I worry about him in that way, and even cosmetically, he just doesn't look very sightly. So I just don't know if there's a way to help someone with his degree of disability.
I see.
I know maybe with many people without disability, I guess you would offer counseling or maybe some medication. I was just wondering if there is some type of treatment or how to treat a person like that.
Yes, so thank you. Yeah, thank you for clarifying. So the treatment is still the same, um, but how you go about the treatment and the language that you use will wind up being a little bit different to make sure that he understands. So it just means it might take a little bit longer, and you might just have to make adjustments along the way. With autism, so there is such thing as stimming within autism. So that is something that you want to just clarify to see if it's stimming or if it's a BFRB. So that would need an evaluation. But if it's a BFRB, and it's just from hearing you speak, it's kind of sounding like it's BFRB related, or within the BFRB category. So I would say treatment is the same. Working on CBT, cognitive behavioral therapy, ACT, acceptance commitment therapy, DBT, dialectical behavior therapy, COMB, the comprehensive behavioral model, again, HRT, habit reversal training. So it's the same thing. It's just, you just have to use maybe different language and go much slower. So focusing on one thing at a time.
Now can you still hear me?
Yes.
Okay. You're in New York.
Yes.
Can you refer me to a clinic? I'm in the Boston area.
Actually, I think there's a good hospital in the Boston. If you email the support at trickstop.com
Yes.
and ask for a referral, or you can even ask to be forwarded to me. Yes, we can look for a referral.
Oh, that'd be great. Now, when you say trick, can you spell trick as in trick stop? Can you spell that?
TRICHSTOP.
Got it. Thank
Yeah,
you so
and
much.
you can, and as a parent, you can always join. I wouldn't recommend for your son to join this program because I think it would be too confusing. But as a parent, you can join the program, either TrickStop or SkinPick. And within the program, they teaches the parent kind of what to do, how to go about it, how you can help your child.
Yeah.
So that's a way that you can get additional support.
I'm at somewhat of a disadvantage because he does not live with me. He lives in a group home, so
it makes it definitely a little bit harder.
Training the staff, and so it would be a little trickier for me.
It's still always worth, or just like looking at, you're here asking questions, which is great. And just looking at some of the webinars that we have just to educate yourself a little bit more and see, what is helpful for you, and what is not, and what you think you can pass along.
Thank you so much.
You're welcome. Thank you. Okay. Thank you. I love that interaction of question answer, actually. So if other people want to raise their hands, feel free to ask questions that way as well. Okay, so we answered that one. Does scalp skin picking tend to get worse or better naturally as you get older? That's a good question. Does scalp skin picking tend to get worse? I would say it doesn't necessarily get worse or better as you get older. It doesn't really correlate with your age. If you're practicing strategies and skills, the more you practice, the easier it becomes and the more you get used to doing them. So as you get older, if you're practicing, it does get easier, but just related to aging, I would not say it naturally gets better or worse. The thing about any BFRBs is it kind of comes and goes. So there is always going to be good days and bad days, or good weeks and bad weeks, or good years and bad years. Something can set you off, a trigger of some sort of situation. It's just one of those days, and then there you go. Then you wind up having a picking episode. So it doesn't necessarily correlate with just age alone. Hope that answers that question. If frustration frequently triggers pulling, what coping skills do you suggest? I think this is a follow-up question. I love it. So how can you cope with frustration? A really common common coping strategy for frustration would be different kinds of breathing exercises, different kinds of meditation and breathing, because when you're frustrated, things are kind of going really fast in your head. You're getting really tense in your body. So practicing different kinds of breathing, meditations, doing a body scan, which is like checking in with your body and focusing on your body. That's a nice way to kind of slow down and regain focus. If you want more information on breathing, meditation, on body scanning, check out the tab on the website under webinars and past webinars, because I'm pretty sure they've done some webinars with examples of breathing and practicing those things. So check that out. I hope that answers your question. Other things besides breathing, meditation, for handling frustration is actually, I mean, so many things. Another thing that comes to mind that is really helpful is just to like get outside, like take a break from what you're doing, take a step back and go outside, go on a walk, go on a run. That's a nice way to kind of catch your breath, slow down your thoughts, if you're able to get outside. If you're not able to get outside, taking like a hot shower can kind of help slow you down and regain balance. Even like drinking some water can help. So, changing your activities and taking a break can help with that feeling of frustration. So you can kind of think a little bit more clearly after you give it a couple of minutes. Okay. I love these questions. Keep coming in. Oh, I have hirsutism. I'm not even sure if I'm pronouncing that correctly, but that means excessive facial and body hair. And I pull only those hairs, not hair on my head. I also pick at my skin, including when the hairs are ingrown. Yep. Would you categorize this as trick or derma? I would categorize it if it's something that bothers you. If you're pulling to the extent that it's bothering you, if it's impacting your daily activities, if it's impacting how you feel about yourself, if it's leading to any infections, then I would categorize it as such. Hair pulling doesn't have to be just hair on the head. It's hair anywhere over the body. So yes, for the most part, yes, I would categorize this within that within the BFRB realm. Having that label, though, I mean, what that means is it kind of gives you a direction of what to do if it's something that bothers you and that you want to stop or manage. If it's something that doesn't really bother you, then it's not something that you necessarily have to work on. Hope that answers your question. Again, if I don't answer a question completely, feel free to ask follow-up questions. Okay, I have keratosis pilaris and am using Gold Bond Rough and Bumpy, but it isn't making the bumps go away. Are there more better ways to help? I keep picking the bumps and it is hurting my skin. Yeah, this is actually a common, I don't know if you condition, and it's a huge trigger for skin pickers for sure, all those bumps. So I don't have the answer for what products to use. I'm not an expert on specific products. But I would suggest going to a dermatologist and seeing what kind of creams that they can prescribe or other forms of medication to help with those bumps. So a dermatologist can help with the bump aspect and the skin aspect, but managing those urges that's something that the dermatologist cannot help you with. That's something that you would have to work on. So things that you can do besides using creams or something that the dermatologist recommends are doing things like barriers to help your skin or to help block you. So for example, a barrier would be gloves on your hands, Band-Aids. I like Scotch tape. Depending on where the bumps are, you can also try to cover that area as much as possible, or in situations where the urges are higher. Again, I hope that answers that question. Oh, follow up to Marsha, I believe, who is asking about a referral. McLean Hospital in Boston, or someone else answered this. A McLean Hospital in Boston. My therapist is in the Boston area, and I found her through BFRB.org site. Yes. Great. So someone answered the question for me. For any providers, if anyone is looking for any providers, you can find providers in your area on BFRB.org, on that website. You can also look at TrickStop and SkinPick. They do have a provider section, and look to see if there's a provider on there. So you can kind of cross-check both of those places for provider recommendations. Do I need to be officially diagnosed before looking into therapy for trick? Any tips on looking for BFRB therapist? Oh, I just answered the question. So the first part of that question, do I need to be officially diagnosed before looking into therapy for trick? No, absolutely not. If you think you have it, if it's something that bothers you, as I was saying before, if you're pulling, it's causing marks, it's causing bald spots, it's causing distress, absolutely start looking for help. Again, you can look for, if you're looking for individual in-person therapy, I guess also virtual these days, you can look at BFRB.org for providers, also on TrickStop.com and SkinPick.com for therapist providers. When you join, if you join TrickStop, you are assigned a therapist. So you're working individually with a therapist through the program, although that is not necessarily video face-to-face. It is more typing based, so it's a little bit different, but it's still quite helpful and nice to have someone to go through this process with and have someone offer you suggestions and guidance and support. Hope that answers that question. How should you approach a doctor or dermatologist when inquiring about trichotillomania diagnosis and treatment? So do you mean what? So if you mean asking a doctor if they've heard about it, you can certainly, just ask, just approach them. Hi, I'm looking for treatment to address my trichotillomania. Are you familiar with this? All right. Do you know about this? How should you approach a doctor or when inquiring? So when you're asking them if they know about it, you also kind of want to know what their history is of working with it. How are they trained? What modalities do they use for treatment? So those are some questions to ask them. So you can make a decision whether or not you want to work with them or not. You might also want to kind of have an intro session, see if they do like a free consult, just so you can see if you connect with them. Having that connection is really important and makes a big difference in your treatment and your journey and your progress. So basically just ask, make sure they know about it. They've heard of it, they're familiar, they've been trained. You just mentioned having bad days and good days, bad years and good years. can you ever fully recover or beat BFRBs? So good question. So BFRBs is a chronic disorder. So that means that a part of it is always going to be with you. That doesn't mean that it's always going to be active. So what I mean by that is part of it will always be with you, but it can be dormant for many years. And then you can have it completely under control, and then something can happen that you don't expect, and then an urge can come. However, just because an urge comes does not mean that you're going to pull. As you learn more about your patterns and learn what works for you and what doesn't work for you, you're going to be more prepared for when those urges do come. So that's the goal. So therefore recovery looks different for everyone. And beating BFRBs also looks different for everyone. But slips do happen. It doesn't mean that you're starting all over again. It does not mean that you've lost all that progress. It's just a slip. It's just part of the process, part of the recovery. After picking my chin, new growth appears. A white attached line appears. Is that the root or cell that keep when the new growth appears? It's a thin white. I'm not sure I understand this question as well. When regrowth is when hair is growing back in, it's going to look different. So again, sometimes it's going to be a different color, a different texture. So yes, sometimes gray. So even if it's coming in a little white, it doesn't mean it's going to stay white. Maybe just that part that you see starts off white and then it's going to change and go back to the color it was before. So it can change. I'm not sure. I'm not able to tell you if what you're seeing is a root or cell. But what I can tell you is that if you're asking that question, it means that you're looking too closely, which, we tend to do, right? We have super spidey senses, so we see everything with great detail. No one else can see it with as much detail as you can see it with. So whatever you're seeing here, I wouldn't focus too much about it. Notice it, say hi, accept it, and see if you can change your focus to something else the best you can. All easier said than done. Okay. Which would you say? Oh, this was a follow-up. Which would you say it is, trick or derma? Okay, and this was the question. Let me go back. Hold on a second. Okay, so which is it? Is it trick or derma? So excessive facial and body hair. I pull only those hairs, not hairs on my head. I also pick at my skin, including when the hairs are ingrown. Would you kind of? So this is all, even though you're picking at your skin, the picking is focused on the ingrown hairs. So I would say that this is trick. However, some people have both trick and derma. So just something to keep in mind. But again, because this is kind of focusing on the hairs, facial, body hair, and ingrown hair, I would say it is trick. Let me see, go back. Okay. Is it common to pull at hair and pick at skin? Although I struggle with hair pull. Oh, so interesting how questions just wind up overlapping here. So yes, it is common to have both hair pulling disorder and skin picking disorder. Again, just because you have hair pulling disorder or trichotillomania does not mean you're also going to have skin picking disorder, dermatillomania. But it is common for people to have more than one BFRB. It's also very common for someone to wind up starting another BFRB if they're working on managing one. That does not happen all the time, but just something to be aware. Sometimes when you're working really hard at managing one, that urge is going to find a way and it's going to pop up in a different way. So just something to be mindful about when you're working on management. Okay, I do have a BFRB. I am just wondering if this behavior below is more trick or derma. Oh, this is the one that I just answered. It's just repeated in a different way. And I pull only those hairs. So again, if you're mostly focused on pulling the hair, facial body hair, and pulling ingrown hairs, that would be trick. But if you're also picking at other areas of the skin, that's derma, or you can have both. It's quite common to have both trick and dermatillomania. Okay, keep the questions coming. I wear gloves to bed when I need them as a barrier, but they aren't useful during the day. Yep, because I need to use my hands to do other things. Yep, I use long sleeves as a barrier, but it is extremely easy for me to get stuck in the bathroom where the barriers are removed. Yep, it seems that I cannot will myself out of picking despite consciously knowing that I do not wish to be picking. Yep, quite common. Other than barriers, what tools or strategies can I practically apply to help? So lots of barriers. There's lots of different kinds of barriers that you can try, but you're absolutely right. Some barriers, like gloves, gloves are really good for nighttime use, but they might not be good to use, during the day. Other barriers, and any barriers, by the way, that you use, you can take off, right? So they only work to a certain extent. Mainly they work as a reminder and give you that pause, that chance to kind of take your hand back and decide whether or not you want to pick or not, or pull. So other barriers, potentially there are lots, but others besides gloves. Actually, first of all, there are different kinds of gloves. There are the thin cotton gloves. They also have something called like the billiard cue gloves. And I really like those gloves because they're very thin and they only cover 3 fingers. They cover these 3 fingers. So you don't get hot in them, and they're kind of cover the picking, pulling fingers. So I really like those gloves. People really like Band-Aids, specifically the cloth Band-Aids, because you can kind of unravel them and play with them. And putting Band-Aids just on the, again, tips of the fingers to block yourself. Again, you can just take the Band-Aids off, but at least it gives you that moment. Another barrier that I really like is Scotch tape. I like it on the tips because then you can kind of flick them and play with them at the tips of your finger. And that's much cheaper because you can just take Scotch tape on and off. So it's more affordable than Band-Aids generally. Other things, especially, let's see, for the bathroom, one of my favorite bathroom strategies is keeping the lights dim if you're able to, putting on some like mood lighting in the bathroom because it prevents you from being able to see more clearly. And it also helps you to be calmer because you have like a dimmer light. Another favorite bathroom strategy is covering the mirrors. So really getting rid of any mirrors you can, cover them. Try to block yourself from being able to see in the mirror, post-it notes on the mirror, putting barriers in front of the mirror so you can't get so close. Those are helpful bathroom strategies. What else? Depending on your location, I mean, bathroom things to prevent you from getting stuck, things like using timers to time yourself in the bathroom. So when the alarm goes off, that's when you know it's time to get out, or time yourself using like a song. I like using songs because it again, has like a calmer atmosphere in the bathroom then. It's like a more fun way to time yourself than setting a timer. So there are so many barriers and tools. I actually, if you're looking for more, I wrote or I updated an article on favorite fidgets, favorite fiddles and fidgets or something like that. It was a list of maybe like 30 to 40, I would say. And I edited that list and I expanded it. So that list is now like 160. Long of different kinds of strategies and tools. So that article list, so as of now, that one is published on BFRB.org. So if you search for like favorite fiddles or favorite fidgets, and my name, Laura Santner, you will find that article. So that will have lots and lots more ideas for you. When thinking about strategies in general, think about the acronym SCAMP. So SCAMP stands for sensory, cognitive, affect, motor, and place. So when thinking about strategies, you want to think about strategies that touch base on all of those categories. I hope I didn't confuse you more. I hope that answered some of your question. Okay. After picking my chin, new growth appears. Some white attached line appears. Is that root or cell that keeps the collagen? So again, I'm not sure because I'm not seeing it. You can also look, you might be able, whatever you're seeing, you might be able to look this up, like just Google it and look at some photos and see what that is, what you're seeing. Whatever it is that you're seeing, though, no matter what it is, I can tell you it's normal. And it doesn't matter if it's a root or a cell. It's growing in, and that's what's important. It's coming back. All right, so don't worry about what it looks like, because again, that whatever it looks like might change as it continues to grow. So focus on the positives that it's growing and you're doing a great job. If you're managing multiple BFRBs, hair pulling and ear picking, what's the best approach to tackle both, or would you recommend focusing on one at a time? That's a good question. It can be pretty overwhelming to manage them all at the same time. You certainly can. Many people do. Approaches for hair pulling and approaches for skin picking are pretty similar. The only difference is you might have to adjust your strategies depending on if it's hair pulling or skin picking. But for the most part, the treatment is the same. So you can use your skills for both. That said, you can think about focusing on one at a time is not a bad idea, especially focusing on the one where your urges are the lowest. I like to suggest starting with whichever one your urges are the lowest, because when your urges are lower, you kind of have more strength and more energy to manage those urges. Once you kind of manage those easier level urges, then you can start to up the ante and work on the situations where your urges are higher. So I kind of call it building your BFRB muscle. So focusing on one at a time can be really helpful in that sense, so that you can build that muscle. But ultimately, it comes down to what works best for you and what your preference is, and what you like. Okay. There really is no right or wrong answer for that. It's what feels good for you and what's the least overwhelming approach, right? So you want to go with what it causes the least amount of stress. I live in Las Vegas. Providers don't accept insurance. That is true. A lot of providers who are specialized in BFRBs do not accept insurance because it is, I don't know why that is actually. It's a specialty. So insurance companies make things very difficult. So a lot of providers don't accept insurance, unfortunately. If you're finding that providers are not accepting insurance and they're just really too expensive, again, joining TrickStop or SkinPick can be a good option because it is much more affordable. Whatever you're paying per month, you really have unlimited access to your therapist who guides you through this program. And you can talk to your therapist basically, or type to your therapist once a day, once a day, every day, as often as you like. And that once a day you can be writing, as much as you want and as much as you need. So programs like this one really do help when providers don't accept insurance, because this one really is quite affordable as long as you're utilizing the resource. Oh, can you share more information about TrickStop, and do you guys have any online groups? I found you guys on Facebook, but was wondering if you had a public forum for people to talk and interact. Yes. Good question. Yes. The answer is yes. Yes. So TrickStop has, I believe there's also a public Facebook group and a public forum. They definitely have a private one as well. TrickStop also has online groups. I believe they have, again, both public online groups and then the private online groups. So if you go onto the website, I believe you can find that information. But yes, TrickStop does provide those services. And the online groups that they provide are on different days and different times, again, and it's to accommodate as many people as possible, because people who join are all over the world, so all different time zones. Okay. Is it normal for hair to grow back thinner than before? Yes, I would say yes, that's normal, because again, hair grows back at different rates and different thicknesses. So if it's starting to grow back and it's thinner, that doesn't mean it's always going to be thinner. It just means that it might be thinner just right now. So just something to keep in mind. Whatever you're seeing, it changes over time. I hope that answered that question. Is it normal? Okay. Okay. We have about 10 more minutes. So I'm wondering if anyone else has any questions. Feel free to, again, write in the question answer section or raise your hand. And if I was not clear on anything, again, please ask a follow-up question. Oops, where does this go? Okay. If questions come to you later, all right, that happens as well. Again, feel free just to email the Trick support at trickstop.com. And if they cannot answer your questions, or if for whatever reason they're unable to answer their questions, they can pass it along to me and I will answer them for you. So again, email support@trickstop.com for additional questions. If any come up later on, they will be happy to answer those questions or pass it along to me and I can answer those questions. And if there are no other questions for tonight, we will wrap it up and end. If you thought this was helpful, also email the support@trickstop.com and let them know, because we can always do this again. All right, we can do this every month, every couple months, you know, whatever the need is, we can do. If there is another topic that you feel you want to know more about, perhaps something that requires a lot more attention, we can do a webinar on it. So we're always open to feedback. And how do you spell Trickstop? The person who wrote that spelled it correctly. Exactly how you wrote it in your question. TRICHSTOP. Yep, so that's trickstop.com. So any other questions, comments, concerns? Let us know. Oh, we got a couple more. I pick till it's raw or infected and leave scars. Yep, that can happen. Scars do go away. Again, they go away at different rates, depending on how bad the infection is. Those scars can last longer or potentially be permanent. If you're getting infections, make sure you're connected with a dermatologist though. So make sure you are treating those infections. That's really important, because infections can lead to more serious things. It is frustrating, and yes, it can happen, but stay connected to a dermatologist if it's really getting raw and infected. So the dermatologist can help you with the healing process. Oh, okay. I see a hand raised. One moment. Okay, I see a hand raised. I'm going to allow to talk. One moment. Okay. Yes. Oh, wait, Anita, let me. Oh, okay, good.
Can
Yes,
you hear-
Anita.
Right. Can you? I picked till it's infected. I wrote that. The problem is when it gets infected, it leaves lines as well, because I picked the chin area.
Mm-hmm.
Keep picking constantly. And even now, as we're talking, I'm picking.
Yeah.
Somebody told me that it could be where her friend died from blood poisoning. Is that possible from just picking the hairs?
No,
Maybe they just wanted to scare me.
maybe, yeah, no. The things that's the most common infection, or the more severe infection that you can get, is called MRSA.
Oh,
So that's something that you want to be mindful of, but you do want to make sure you're connected to a dermatologist so they can look at the spots, look at the infection, and let you know what's going on and what they need to do to treat the infection. But no, it's not gonna, you're not getting blood poisoning from picking.
okay.
Yeah.
Could you please spell Simplus? The other trick is one. What was the other information?
A skin pick.
Oh, skin.
Yeah.
SINK.
Yes, SKINPICK. One word. So they're both one word. Skinpick.com and trickstop.com.
Okay. Thank you very much.
Yes, you're welcome. Thank you for asking your question and clarifying. Okay, very good. Let me just check to see if any other questions came in. So trick and dermatillomania, same treatment is the question. So yes, the short answer is yes. They're both treated with the same evidence-based modalities, which is the comprehensive behavioral model, which is COMB, the acronym is COMB, CBT, cognitive behavioral therapy, DBT, dialectical behavioral therapy, ACT, acceptance commitment therapy, HRT, habit reversal training. So both trichotillomania and dermatillomania are treated with those same modalities. The difference is that or the specific strategies and techniques might be a little bit different, because one is you're picking your skin and one is pulling your hair. So for example, if you're a hair puller, the strategy that someone mentioned, wearing long sleeve shirt, that's not going to do anything for you because you're not picking your skin, you're pulling your hair. So the specific strategies will be different, but the overall modalities are the same. Okay. And both, by the way, again, you can get treatment through skinpick.com and trickstop.com. Is there any emerging study regarding trichotillomania? That's a good question. There are always studies going on. There are always studies going on and in different places, so it's kind of hard to keep up with them all. You can look at the website and see what studies have been done. I'll double check to see if TrickStop is keeping up to date with studies. It's kind of hard just because there are always so many. That said, all of the studies are usually very small sample sizes, so those studies might not necessarily be out in the public and easy to find. There is a scientific advisory board at the Trichotillomania Learning Center, or BFRB.org. So at that scientific advisory board, they would be the ones to have the most up-to-date research. That said, their website is not the most up-to-date, so you can always try to contact them privately to see what the most up-to-date things are, or if you have questions regarding research. And again, I'll check with the team here and see what kind of research we have, or you can check on the website to see what research is published on the TrickStop website. And if there are more studies that are not there, I'll let them know and we'll get on it. We'll publish them. Oh, someone went to my article, the Great Big List of Favorite Fiddles article. Yep, want to let you know that several of the links are broken. Oh no, okay. Well, I don't know which ones are broken or lead to unknown Amazon pages, but I don't know which ones are broken, but I'll have a look. So thanks for letting me know. But regardless, I think the description of them still hold the same. So if you look at what the fiddle is, if you just Google the fiddle, you can find it, whether it's on Amazon or the therapy shop. Both of those places have a lot of fiddles. But I'm sorry that some of the links are broken now. Guess that needs to be updated again. Okay, I got a bunch of thank yous. So thank you for your thank yous. I appreciate that. I hope that I answered your questions. Again, thank you so much for participating. I really appreciate it. I loved all the questions. More questions that you have, feel free to email them. If you want to do this again, let TrickStop know. And I hope this was helpful and informative. Thank you so much, everyone. Take care.